I'm Dr. Barry. I'm a psychologist, and here I share legal and entertainment news from a psychological perspective. And today I'm doing one of my educational videos. I love covering cases, I love covering different things from the media. Today, I wanted to break down complex trauma and personality development. And a lot of the cases that we cover, issues related to personality disorders come up. And towards the end, I'm going to go over like what's the difference between CPTSD and borderline personality disorder. What's the difference between borderline personality disorder and narcissism. I also want to talk about histrionic and antisocial personality disorders. And I'll briefly just kind of mention all of the personality disorders, but I thought this would be a nice foundational video as we kind of move forward and learn about all of this. And so, welcome, welcome. So glad you're here live. You're a physician that works in child mental health. That is phenomenal. And welcome to any survivors, any complex trauma survivors out there. I do try to provide resources and tools and talk about how we can heal these things as well. And so, welcome, welcome. All right. And I will just kind of be grazing the chat and I'll try to make sure to read the question when they come up. Hi, Dr. Barry. I'm very excited to hear what you have to say. I'm always concerned I'm going to develop a personality disorder because of my trauma. And because you're kind of aware of this, because the thing that happens with personality disorder development, so personality disorders are going to be the extreme and there's going to be a lot of variation somewhere in the middle. And anyone that says they don't have any zero traits of any of these things, like mm. We all have our personality. With all of these disorders, it's getting to the point where it starts to impact someone's functioning. So please do not diagnose yourself based on this video. Like, this is not for diagnosis, this is for educational purposes only. I do think self-diagnosis is very valid, but I need to make sure that I'm using the correct lens. And what I mean by that is when I was in graduate school, learning about all the different diagnoses, especially our psychopathology class, where we went over, at that time it was the DSM-4. We are now on the DSM, Diagnostic and Statistical Manual, that's put out by the American Psychiatric Association. We're now on edition number 5. But with all of that, we were told you are going to think you have everything. You do not. There, because you're like, oh, I have this symptom, I have this symptom. Now there are people that don't have access to appropriate assessment, and they're not able to get, pay $2,000, $3,000 for a full assessment, and self-diagnosis is kind of the best thing that they have. This is a great question, and remind me to bring it up later because there can be some overlap in some of these symptoms. So, there can be overlap with trauma symptoms, there can be overlap with borderline personality disorder, and there can be some overlap with autism. It takes a skilled diagnostician. It takes a skilled person to kind of figure out where things are. So, I specialize in assessing for the effects of trauma. That is my specialty. I do not specialize in diagnosing autism or autism spectrum disorders. I work with people that have already received that diagnosis, and in therapy and treatment, we are working on those symptoms. Many of them do have, just from my practice, because of my specialty, many of them have their own experience with childhood trauma, adoption, and with that, it's my goal to just help give them a safe space to share. So that's always my goal. There will be some triggering words. It's my goal, so I'm not going to go into the words, but there will be some things that are mentioned that may be triggering. All right. So let's just start with what is trauma. Trauma literally means wound, injury, or shock. And a traumatic event is anything that someone finds overwhelming, and people will differ in what they find traumatic. Two people can go through the exact same experience, and one person develop PTSD and the other person not. And there are a lot of factors that can go into that. And then also it's the response of the people around them. When I'm working with survivors who disclosed their trauma in childhood, I often ask, how did people find out that you weren't safe? Because in my experience, often the people that reported the situation to a teacher, to a counselor, I often see very severe symptoms because there can be a lot of shame and guilt that can go along with that. And then also, that can be the person that sometimes did have some very big behaviors. They were connected with the mental health system. That was how people knew that they weren't okay. Because when people, especially children, aren't okay, we know this because of their behavior. That's just how, those are some of the first signs that we often see. And then also, somebody can be in an unsafe situation and not show a lot of major symptoms, especially if it's a secret, especially if, because kids don't know what's normal and what's not normal. And the biggest case that really comes up for me is the Madeline Soto case. So Madeline Soto was a missing persons case. That's how it started. And the boyfriend, we're learning a lot, because she was recovered, and the boyfriend has been arrested for child harm and for child material. And it's come out that the mother would sleep in her bed alone, and he would go sleep in Maddie's bed. And that's a huge red flag for me. And he was her stepfather. He was not her biological father. And at her age, because he tried to say weird things like she needed him. Like, there was just, it's a very, very creepy case. But she did not appear to show major signs of trauma, but that's the secrecy of it. And that's what can happen when you groom somebody from 8 years old. They don't know what's normal and what's not normal. And there are some people that are very skilled, where they make it seem like there's care, and it can get really, really, it can get a little disgusting. And so, uh, thank you, Miles. So I did some trainings with a social work program. I think I'll have to find it. I think it's continued ed social work. And some of the programs, because I recorded them a few years ago. I don't know if they're still up on their program. And if I ever do offer any paid trainings for professionals, I will definitely share. I did apply to present at a conference next year. And if I get that opportunity, I will definitely share for any therapists or mental health professionals that follow me. If anybody wanted to attend that event, I will definitely share. And then I do take speaking engagements if people know of any opportunities out there. So, all right. So, in the past, people thought that in order for it to be a trauma, there had to be physical harm that happened. But we know emotionally stressful events can also cause trauma. Neglect can cause significant issues. Be exposure to natural disasters. Definitely physical harm, the intimate kind. I'm going to scroll up so it's not on, so YouTube doesn't get mad at me. Exposure to DV in the home, exposure to parental substance, exposure to a lot of screaming, yelling, individuals that grow up with a parent that has narcissistic personality disorder, and then if they then take out that emotional harm on the child, that child can end up having a very fragmented sense of self, because we often learn who we are and our value from our parents, but sometimes that individual wasn't safe and they weren't the ones that were able to do that. So what is complex trauma? And the thing about the difference between, like, PTSD, a soldier that goes away to war and comes back and develops nightmares, flashbacks, those types of symptoms versus complex trauma. Complex trauma was repeated and ongoing, and it often occurs within a personal relationship, often beginning in childhood, and it can affect development. So, social development, emotional development, and truly, the person's sense of self can be impacted by this. Now, there is healing, and different people can use different resources to come out of the same situation. So once again, just because two people go through the exact same thing, and how people survive, especially how they survived their unsafe environment, that's where they just have to get safe. The problem comes when people take the survival strategies that they used when they weren't safe, when those same strategies come in to a safe relationship, a safe situation. All right. Um, So there are different effects of a single incident versus complex trauma. So often a single incident, the healing process can sometimes be a little quicker because you're only working through one event. That person, while they might view what they went through as it might not change their fundamental view of themselves and the world. It can, but that's less likely. With complex trauma, it's very common that it can really affect somebody to their core. And in order for healing to happen, they have to experience felt safety. So safety has to be felt. And one of my favorite trainers, he did, and I've talked about him here before. Um, he did a training, and y'all know me and names off the top of my head. I don't know why I do this to myself. Doctor, because he did forward facing trauma. Doctor forward facing trauma. Yes. Um Let me, because Dr. Eric Gentry, I was able to attend, I think 2 or 3 of his trainings, and his approach with forward-facing trauma, where we can do trauma work without having to go backwards. Because if I can give you safety in this moment, if we can help reprogram your nervous system where you're no longer responding to neutral or even positive events in a threatening and an unsafe way. And when an individual does get triggered, because we're all triggered from time to time, but somebody that has experienced complex trauma, that their alarm system, that feeling of not being safe, it can get stuck on where they experience lack of feeling safe and seen and understood, even in safe situations. So people normally understand not feeling safe, seen, and understood in that unsafe situation. But for some people, just because of those patterns, because of things that they've been through, they can have difficulty experiencing that safety, even in safe relationships. And what we sometimes have to start with is rewiring the nervous system. And I often try to have clients start with their breath because it's something that we always have versus having like a specific app or having a specific thing. I've done other videos I think on grounding techniques, but helping clients ground themselves, that can often be very helpful. All right. And I love, because in the past I've talked about the different responses, different trauma responses being fight, flight, that submit, and then people pleasing. Um, because I didn't learn about people pleasing in graduate school. That's more, as more research has occurred, that fawn response is real. And with people pleasing, what can happen is the person looks like they're functioning well, but the idea of telling someone no brings up fear, brings up intense feelings of, and with somebody with borderline personality, like somebody on that more severe end of borderline personality disorder, the idea of setting a boundary can bring up those fears of rejection, abandonment. And then because that's where like ADHD, all of these things can sometimes overlap in ways, and people can have more than one diagnosis, and people are kind of commenting what their go-to response can be sometimes when they are stressed. And for so I try to have people, please don't judge yourself in how you respond. The goal is for the that response to not take over your thinking brain. So our world has evolved faster than our brains. The part of the brain that gets triggered in all of this is the amygdala. I've talked about amygdala hijack, but it's always great to come back to it because that is a small almond-shaped part of our brain. Sometimes we'll refer to it as reptilian or our reptile brain because it once it's triggered, you are going to go into one of those responses, but then I want to choose about whether or not to stay there. So right now in this moment, if I were to hear a really loud noise outside, my animal brain, my reptilian brain would kind of step up to be like, "Oh, I wonder what that was." But as long as I couldn't see any damage, as long as, I don't start hearing sirens or something, I would generally be able to settle my system relatively quickly. For some individuals, once they're in that triggered state, it can take a while for them to get back to regulation. I've also worked with some clients that were never able to stay in a regulated state for longer than a few minutes, maybe. And then that's our goal, is to increase how much it takes to get them into that state, to start to help give them tools to manage this. And I take a dialectical behavior therapy approach a lot with clients if it's the right fit for them, to help give tools of, hey, is this working, what is this working? And then I do make myself available by phone to but not on like a everyday 24-hour basis, but clients know if they're in a real difficult moment that they can message me, and when I see it, that I will send them a resource, I will send them a tool, I will give them something. Now, if they are in crisis, that's when they go, that's when they use their other, so they might need to reach out to our 24/7 mental health support, or they might have to go to the hospital or something like that if it's that type of crisis. For a lot of people that I work with, even if they are in crisis, if they can get through the next 5 to 10 minutes, for many of them, that's enough for them to get back to their grounded state. So for every person, that's going to be different. I tend to be a pretty mellow person, like unless I'm anxious. So I've told you all that I manage anxiety on a regular basis. And a predisposition to anxiety can sometimes increase a person's risk for developing trauma disorders. And I think it's just part of the same system. These are my personal beliefs. This isn't all of the research continues to explore all of this, but something that I know for my own life is that with the anxiety, there was already that fear of like, what if this, what if that, and then something happens. It can then make it like, okay, I need to control more. It can kind of make that anxiety part worse, and that can feed the anxious trauma cycle, feeding the, well, what if this, and what if, and I have to make myself completely. And so something that I have to do personally is acknowledge everything is not going to be in my control. Things aren't always going to go the way that I want them to. And like sometimes life happens and I didn't do anything wrong. Like I should live in a world where I don't have to worry about people, about something bad happening to me. I shouldn't have to think about that. And yet, we do live in a world where sometimes things happen. And the most interesting thing about this world is often the people that are the biggest threat are often the people closest to you. And I'm in a neighborhood Facebook group, and people, if we have somebody that moves in that's on an offender registry or something, people will get all up. And I understand why, but people will kind of get upset. They'll like post, oh my gosh, like, this person lives down the street from me, watch your kids. And it's like, you should also check in with your kids about their coach, about their pastor, about their teachers. I'm seeing so many, like Law and Crime has been posting so many teachers violating boundaries. Like I and a lot of female teachers. There's a, I'm seeing more and more of that. I think it's always happened, but I think males are more likely to report some of that harm than they might have done in the past if it was a female teacher and male student. I remember growing up, sometimes people would brag. So if there was a 14-year-old that had a 20-year-old, and I never knew of a situation like this. These are just like rumors and things. If there was a young boy that was dating somebody older, sometimes people would almost think, "Oh, you're a man," or I don't know. Like there were different thoughts and things. I was born in the '80s. I'm an '80s baby, and I'm glad that that narrative has changed around a lot of these topics. All right, so. Um, so complex trauma can begin as early as prenatally. So I've worked with clients who were conceived out of difficult situations for their mother, and their mother, and that child grew up knowing that their father wasn't a safe person. And sometimes the mother then had to fight for, to if they were trying to withhold visitation or different things. And there are times when somebody where they do, if it's the birth father, even if there's a certain history, sometimes they do still have to allow visitation, which can cause all types of issues. You can just imagine. But the mental health of the parent can definitely have an impact on the child. That's excuse me, that's why I've shifted. I got into psychology to help kids. I desperately wanted to help kids and teens. And after doing this work for about, it was COVID. It was really COVID. During that time frame, I really realized that I needed to shift away. So and yes, so stay there. So ask dada for dinner, or you can have a snack. Okay. Yes. My child can only sense he's hungry. Please close my door. Please, yes, go ahead. Yes, yes. So I need to make sure that it's okay. Okay. Did Dada ask you? So or do you want macaroni and cheese? Okay. So then wait for me until 7 p.m. Okay. All right. I know you don't like to wait. Please close my door. People got so mad. I'm telling you, the one time I did, because one time I was doing a video, he came in and I was just like, he had on his headphones. I was like, fine, he can stay. I mentioned him at some point in the video. People got so mad. Not, it was like five. It was like five people. Okay. And so it is what it is. And I like that y'all get to hear me parent, and it's not even, so this is how I communicate with him even if I wasn't recording. This is how I talk with him. And I am going to do a parenting book for the cycle breakers, the people that are doing things different. If that had been me when I was a kid, if I had walked into my mom on a meeting, she would have given me a look of why do you exist? Like she would have like given me a like, and I would have felt like I was doing everything wrong, and I just wanted, I don't know, like I try to talk to him in a way. He knew to like my boundary with he stays off camera. I'm facing the back wall, my door is over there, and I set it up that way on purpose. Before I started, I was like, "Okay, I'm gonna lock the door." Like but I was like, "I don't wanna be streaming, him knock, and then I have to talk to him through the door." It was a pretty good chance that I was going to get interrupted, but, that is why I want to write this book. Now my child, I tell him no. I set boundaries. I would describe myself as somebody that kind of blends. conscious parenting, a little bit of gentle parenting, combined with just authoritative parenting, where there are clear boundaries, there are clear expectations, but I acknowledge his feelings. And he's 6. He'll be 7. He's only 6 years old. And so I let him be a kid. At 6 or 7 years old, he's going to interrupt. So I work with clients that they were harmed for just being a kid. They were harmed for bedwetting, for, you know, asking for food, for, like they were just being a kid. They weren't doing anything wrong. And this whole idea that kids should blindly obey, that's that's problematic because it can set kids up to not disclose if something inappropriate is happening. If I set up with my kid, "Oh, adults are always right. You always listen to the adults." Well, what if my child is encountering an unsafe adult? What if something happens with an unsafe child? Like, that's where I want my kid to always come to me. I've done a video in the past about trauma proofing your kids. Whew, and I think I did it around the time that my child was going off to kindergarten, which brought up because I remember I told y'all I'm Patrice. I have anxiety, and it brought up because this was the first time I wasn't gonna have control over, like, where I don't know, like, there was gonna be so much less control. When he was in daycare, he was right down the street from me, from my mom. Even now, our home is relatively close to the house. I'm sorry, to the school, but, he went on his first field trip this year, and that was the first time he'd ever been somewhere without me or dad, and, he had a great time. He had a blast, and I'm so glad that he gets to have those experiences. He went to his first spring break camp, like, it was a little half-day camp, and they played Minecraft and did stuff like that. He had a ball. It but when I walked into the Minecraft class, the guy looked a little interesting. He was fine. He was a nice guy, but he looked kinda but I can't judge people based on how they look because there are people that look fine and aren't safe. So I can't use my normal senses to judge if somebody is okay or not. I just can't. I do send my child to places that have like monitoring, that do background checks, all that good stuff. Um, uh, yes. So that's me. That is me. Let's talk about the effects of childhood trauma, specifically complex PTSD. So, children whose families and homes do not provide consistent safety, comfort, and protection may develop ways of coping that allow them to survive and function day to day. For instance, they may be overly sensitive to the moods of others, always watching to figure out what the adults around them are feeling and how they will behave. They may withhold their emotions from others, never letting them see when they're afraid, angry, or sad. These kinds of learned adaptations make sense when physical or emotional harm is present. When a child grows up and encounters situations and relationships that are safe, these adaptations are no longer helpful, and it may be counterproductive or interfere with the capacity to live, love, and be loved. But complex trauma can affect children in a multitude of ways. Here are some common effects. So, complex trauma can affect attachment and relationships. The importance of a child's close relationships with a caregiver cannot be overstated. Through relationships with important attachment figures. And we know this occurs as young as like pre-verbal infants. How you respond to an infant, how those early years. And for me, those were some of the most stressful. So I work with a lot of new moms. I work with individuals that want to be a parent. And then once they do become a parent, something that I allow is that they can bring their child with them to therapy if they're comfortable with that. Or we can do virtual sessions and their child can be there because often figuring out being a new parent comes with this whole new territory, all these new emotions, this whole new identity and all these new frustrations. And then I'm also monitoring clients for postpartum issues and giving them a safe space to talk about all their partners, all the things. I was gonna say worthless nipples because it's a thing. It's just a safe space where they can be them. And there's some therapists that don't allow that. And so that's where if I was pregnant and looking for a therapist, I would ask, what's your policy on kids in session? Because some therapists have a no, no, you can never bring children, can't be anywhere in the room. For me, it's something that I adapt. Now, we're not going to process trauma while you're holding your no, like we're not going to do that. And there are clients that will get daycare and they want just their session. They don't want to bring their child, which is okay. And I also warn them, if you bring a baby, I'm easily distractible. Like I'm gonna be listening, but I'm gonna be playing with the baby. Like I'm gonna be like making faces. I just am. Like just that's just who I am. That is what is going to happen. All right. And so there we go. All right. Through relationships with important attachment figures, children learn to trust others, regulate their emotions, interact with the world, and they develop a sense of the world being safe or unsafe and come to understand their own value as individuals. When those relationships are unstable or unpredictable, children learn that they cannot rely on others to help them or that they have to do something in order to get that love or help or support. Children who do not have healthy attachments have been shown to be more vulnerable to stress. They have trouble controlling and expressing their emotions. They may react aggressively and inappropriately to situations. Our ability to help healthy supportive relationships with friends, oh sorry, they might impact their ability to develop healthy supportive relationships with friends and significant others. And they might also have problems in romantic relationships, issues with authority figures, and that's when you start developing some of those antisocial type traits, when there start to be issues with authority. All right. So the effect on the body and brain. So I have this linked below. All right. And extreme stress can affect the immune system. It can make someone more susceptible to chronic illnesses. A lot of my clients that have lupus or that have um, a lot of autoimmune concerns, many of them also have histories of complex trauma. When the stress response stays on, it makes that cortisol. So cortisol, that stress hormone, gets overproduced. And then what happens is, because if a bear is chasing me, I don't need an immune system. But the problem comes is if I stay in this heightened stressful state and I'm never able to experience any amount of peace. And so that's where I try to create safety in session for clients so that at least maybe in this moment. And something that I do is if I'm working with a client and if they start to have a trauma response. And what I mean by that is if they start to close their eyes and they start to, from where I am, it looks as though they are reliving the trauma in this moment. I will say their name. I will apologize for interrupting them. I will ask them to open their eyes and tell me 5 things they see. I'm gonna we're gonna do different grounding techniques to bring them back to their body, and I'm going to explain that those are things that they can do, that processing trauma from this state, I want them to process their trauma from being 35 years old, here in my office with me, the traumas behind them, versus processing it as though they're back 7 years old, stuck under like in that situation. I want them to be here in this moment with me because processing it from, they call it an ab reaction, processing it from this place often is more painful. It often brings up and it brings up more, and it can often be re-traumatizing. It can make people not wanna go back to therapy. Like, so, that is there was an approach, it's called exposure therapy. I do not do exposure therapy, where a person just talks about their trauma over and over, and you're trying to desensitize them to their reaction to it, and they actually paid people to experience exposure therapy, and people dropped out because it was just that painful. So I do not do that. Sometimes we will do gradual exposure, and great question. So EMDR, and I have done other videos talking about different types of treatment. What EMDR does is it does bilateral stimulation, and when you're going through processing the trauma, you are going to be regulated. You are so yes, typically EMDR, if a person is able, if it works for them. EMDR doesn't work for everybody. I've had clients have good experiences with EMDR. I've had clients that have had bad experiences. And I was looking around for a pen. Let me see if it follows. Okay, yep, it's gonna follow me. Alright. So sometimes the therapist will it's like you use your eyes to follow the pin, or they'll have a clicking thing where you click back and forth, but it's about bilateral stimulation because the way that traumas get saved in the brain, they don't get stored away in our hippocampus, in our memory, and that's why there are flashbacks. That's why they pop up when you're not expecting it to, because they're these little fragments that just get stored anywhere, and that's why a person can it can just come up out of nowhere and the person not even see it coming because it's not a memory that's stored away. What what EMDR helps to do is it works through a lot of the sensory experiences, and it's meant to do it in a way from a regulated body. There's a lot of great research on the use of um, medication assisted therapies like microdosing, but that is like under the supervision of a therapist. They've started doing this with veterans, which I think is really awesome because what it does is it lets them process the trauma without having the reaction. But you're doing it with a licensed therapist who's monitoring and making sure that everything is safe. I am not trained in it. I follow a therapist in Washington, D.C. She is certified in it, and she thinks it's helpful for people that dissociate a lot, that have strong dissociative experiences. EMDR can sometimes not be effective, and so this individual said EMDR did not work for me. I tuned out. I tuned it out and started thinking of what I had to do that day. Yep. And so but I didn't even read that last part of it, and I just read the first part, and it triggered in my mind that often people that have severe dissociation, or that in as things get difficult, if the brain defaults to dissociation, often EMDR is not gonna be helpful. One of my favorite, things to talk about is internal family systems. And I did a whole video on dissociation and dissociative identity disorder and internal family systems, but it also works with trauma because trauma has a way of fragmenting you, and it lets a person talk to the different parts of them in a way that's validating and supportive, where it's like, that's that firefighter part. There are it does this parts work to help reintegrate the person to have their true self. Because often there are these other parts that are protecting the true self, and it kind of can be a way of a person working through some of their like issues with identity, sense of self, stuff like that. And so that's another one that I like. Somebody mentioned ACEs, adverse childhood experiences, and school. And I think I have a video talking about trauma informed schools, because if kids are experiencing trauma, so kids that are living in high violence areas, they often have lower test scores because when your brain is in survival mode, you can't learn. And so it's really important as a teacher, if I'm seeing a student struggle, if I'm seeing things happening. Now, sometimes people just have like it's not trauma, it's something else. It's not always that, but sometimes that if I know this student has is currently in foster care and they're on their fifth foster home, the thing I want to instill in that student is that they're safe in my room. If I can create that safety, I want to help them know, I want to build a relationship with them. That all of those things, that before I try to teach this student, that student has to know that I care. They have to put, if they can, if they're able to put some of those guards down. And then also as a teacher, I might know, hey, this year is the year that they're in and out of court related, that their parents' rights are being terminated. And like, this is going to be a tough year. And so the goal is just to get through it. And if this kid doesn't learn geometry this year, okay. Like, mm, but if they can have an adult, a safe adult that, you know, let them put down their head because they weren't getting enough sleep at night. If they have different ways to be able to support themselves, that can be helpful. There is a book on internal family systems. I have it in my Amazon resource list. I'm gonna have to break it down because I have way too many books in that list. Um, what's the Yes, No Bad Parts by Richard Schwartz. So Internal Family Systems was developed by Richard Schwartz, and so that is one of my favorite books on internal family systems. No Bad Parts. All right, let's keep going. All right. So it can have an effect on emotional responses. CPTSD can affect the way a person reacts and experiences, and it may keep them from effectively processing their emotions. And it can also lead to dissociation. That's that detaching or disconnecting. And it can also increase behavior issues, impact cognition and learning, and then impact their self-concept, their self-worth, and their relationship to other people, and then also their view of the world. There's often this shame that comes with CPTSD that isn't present with PTSD. So, um, sometimes there can be shame. So this isn't like an all, a one statement. It's just you're more likely to see issues with shame and the self with CPTSD versus PTSD. All right. I also have this linked below. It just talks about how early childhood trauma is unique and there are formative years. There's all of this development that's happening and people can get stuck at certain responses cuz I've worked with clients that when their boss talks to them in a certain tone at work, it triggers a response in them that takes them back to when they were 7 or 8. And we kind of talk through, what did you need to hear at that 7 or 8? Because the client in their mind is almost feeling helpless as though they were still 7 or 8 and they're not in their 35-year-old body. And I'm just pulling out numbers. Wherever they are today, they're not here, and sometimes their conflict resolution is still very immature, and we might have to work on, how do you set a boundary with, your partner, in these different situations with a coworker, etc. Right. Let's get into personality disorders, and I might have to do a part 2 with this, we will see. But with personality disorders, and this is from the American Psychiatric Association, personality is defined as the way of thinking, feeling, and behaving that makes a person different from other people. We all have a personality, and personality is influenced by someone's experiences, their environment, and certain inherited characteristics. A personality typically stays the same over time. So that's where when people ask, can somebody with narcissistic traits can they change? And it's like they can learn new skills, they can learn new ways of seeing things. There might still be that underlying personality pattern, but do they learn to respond differently versus their default? All right. To be classified as a personality disorder, one's way of thinking, feeling, and behaving deviates from the expectations of their culture, causes distress or problems functioning, usually across different settings, not just one, and it lasts over time. So, if somebody has been experiencing symptoms, and some people will get mad at me I will not diagnose a personality disorder in an individual under the age of really like 20. I now 18, so like depending on what's happening, if the person's 18, clearly meeting criteria, I would go on ahead and diagnose it. To me, your personality is still developing, and so much of who you are is based on the choices other people are making as a child. Because I have this child coming to me with all of these symptoms, with all of these issues, and I have no idea what it's like to live where they're living. There could be some undisclosed things happening in the home. There could just be so much, and I don't know how their personality will change once they don't have high school drama and they don't have, they're not forced to visit a parent, they're not forced into all these different things. And so that's why I personally stay away from diagnosing personality disorders in really younger. And then also a personality diagnosis can impact people's ability to get life insurance, to sometimes get health insurance. It can really affect a lot of different things. And there's a lot of stigma associated specifically with borderline personality disorder. I've mentioned, and I will mention it again, if I'm working with a client that has borderline personality disorder and they're moving to another state. So I'm no longer able to work with them because I don't I'm only licensed in the state of Virginia. I would work with that client to find a new therapist and say, find somebody that has experience with CPTSD. Find somebody that has experience with, if they're doing well with dialectical behavior therapy, let's find another DBT group. Or I would try to find a therapist that specifically lists that they work with individuals with borderline personality disorder. I've seen in therapist groups, therapist, you don't want to, the things that people say, and to me, the way that I view BPD is the person lacks emotion regulation skills, they lack communication skills, they lack interpersonal skills, and in my mind, the person is doing the best they can. The problem is there's a gap between the best they can and what's functional, what's helpful, because I wanna meet them where they are first, and I need to meet them with non-judgment, and people get mad at me for this. People get mad in the comments. Ah, and what sometimes happens in the comments, the latest video that caused the most issue for me with this is the Karen and Michael Murray video. People were so mad that I had compassion for the sister that appears to present higher functioning than the siblings, Karen and Michael, but I don't know their life. I don't know their situation. The state chose not to charge her, but people get very, very upset. And so, what helps me do the work I do is to not have judgment. So I don't talk about Stefan Stearns. Like I haven't covered, I don't think I've ever done a video covering Madeline Soto's case because I can't approach that case from non-judgment. I can't. I have nothing. I don't want to know what is in his those things. I There are people that I don't work with. I do not work with people that essay children. I don't do that. That is not work that I do. That work is incredibly triggering for me, and so I don't cover cases that are triggering for me. I think I did talk about Maddie in general, but I won't talk about like him and what could be going on with him. If a psychologist comes on and they talk about that, I might be willing to cover it because I have that buffer of somebody else's perspective, but I won't cover it. And I know that in the comment section, especially for videos that get over 10K, YouTube is going to find people that don't like the video because engagement is engagement. And it's hilarious to me that people comment. People get mad. People get so mad and they argue and go back and forth. And I just can't. Like, I don't have the time. And I'm so glad that before I started YouTube, that I had some videos do well on TikTok and a few videos do well over on Instagram. And so I knew like what to engage with, what not to engage with. I changed my intro today. People got so mad. Somebody in the comments was like, "Why are you using Jordan and McKay's intro?" And it's like, it's a free intro in StreamYard. My little black countdown, that's not my intro. That's a Jordan and McKay intro. Like people get mad about the silliest things. But it's not silly. I say silly because from my perspective, it's like, wow, that's a big reaction. Because I think the person legit thought I was stealing somebody else's intro. And it's like, no, like that's in StreamYard. Like they have free presets. And so it's a preset in StreamYard. I did comment back because the person they were giving some constructive feedback. And so I did respond to that one, but to other ones, I don't. So, what I mean by approaching things with non judgment, I would not work with individuals with borderline personality disorder if I was going to sit on the other side and judge them. So, I work with clients that are currently in DV situations and they may never leave them and they're safe. So, like, there's not, so when I say safe, because they have all the resources, there are no children in the home. They sometimes they're in financial situations where they can't leave. Sometimes it's just for whatever reason they make their choice. I never force a choice on them, but meeting them where they are and helping build them up and their sense of self, that's often very helpful, and giving them a place where there's not shame. So there's a difference between guilt and shame. Guilt is what I did was wrong. Shame is I'm wrong. So when my kid interrupts the stream, I never feel shame. I don't really, well, the first time it happened, I did feel a little embarrassed because I y'all know I have processing issues, I have speech, I lose my train of thought, and so at first there might have been a touch of embarrassment, but there was never shame. This is his home. It's all of our home. I'm streaming from home and he might interrupt me. That might happen. And but there are times when a person will feel like I'm the worst streamer ever because some minor thing happened. When my stream freezes, we're doing really good today. At those times when it freezes, I don't, feel shame about any of that. I had this teed up to a good pause for Dr. Ramani, because in talking about this next section that we're going to move to, borderline personality disorder or CPTSD, I have a video that she did down in the description with Med Circle. And so I have that one down there. But in it, the overall gist of it is that with borderline personality disorder, that is an emotional dysregulation, a reactivity, and their issues in relationships and an issue with the self. And then also with borderline person oh, sorry. My bad. So with CPTSD and borderline personality disorder, this is where they can overlap. That in both of those, there can be this difficulty regulating emotion, there can be a reactivity, there can be issues in relationships, there can be an issue with self. But in BPD, you're typically going to see this intense, chronic fear of abandonment that also includes some uh like some self-harmful, that's going to include some other traits that go beyond a CPTSD. A person can have both. And what I mean by both is somebody with complex trauma can have borderline personality disorder. And a person can be diagnosed with borderline personality disorder and not have a history of trauma. I personally haven't seen that. Every individual I've worked with that has borderline features or borderline personality disorder, they typically do have a history of childhood trauma. All right. And uh so very often, borderline personality disorder can get confused with CPTSD. And I will also state that CPTSD is not a DSM 5 diagnosis. So I will often mention it in the comments of a psychological evaluation, but I don't list it in the um I saw a good comment, and I'm trying to stay focused. It's not a DSM-5 diagnosis. It is in the ICD-10 or 11, that's the international codes, but it's not something that insurance, 'cause I go with DSM and with what is reimbursable. I accept insurance. 98% of my clients are, maybe 95 to 98%. Like, I think I have 2 or 3 cash pay clients. I Most of my clients are insurance based. So we have to advocate for it to get added to the DSM. And we do. So there are definitely proponents that are advocating for that. And the most recent addition to the DSM-5, they lowered some of the standards for kids to meet criteria for PTSD because there were kids with confirmed histories of trauma that weren't presenting the way PTSD is written. Because the way PTSD was written in the DSM-3 and maybe even a little in the DSM-4 was really more of an adult experience, and it really didn't describe fully what we see in kids and teens. And so they did make some revisions to PTSD, but we still have a long way to go. Most doctors and psychiatrists and therapists are aware of CPTSD and how to treat and how it's different from PTSD. And so normally if somebody says that they have a history of CPTSD, they often meet criteria for PTSD. And I include in the description that they have complex trauma. I often include their ACEs, that adverse childhood experience scale number, which can be a 0 out of 10. I think 3 is average. I think, like, a lot of people have been through some type of negative life event, but the higher the negative life events that happen in childhood, the more likely somebody can experience negative, so more mental health concerns, more medical concerns, all of those things. A person can also be resilient. So I don't wanna go through all of this and not talk about resilience, that there are people that can go through the worst of the worst, and many of them are therapists and doctors and nurses, firefighters, sometimes police officers, often turning that that pain, giving it a purpose that can often help an individual. The reason why I became a therapist, I had a horrible middle school guidance counselor, absolutely horrible. Uh, Horrible. And I wish I had received therapy when I was a kid and a teen. I did get therapy as an adult, but and my first therapist was not the right fit, okay? So I'm a therapist. My supervisor recommended somebody. She was not the right fit. And I thought it was me because this was again back in the 2008, I think. And people weren't talking about like a therapist not being the right fit. I knew from my training that the person had to be, a good fit. That's a good thing, but it was a whole thing. So, uh, this I love nerding out with you all, and I literally created this channel to do videos like this. Okay, like this is why I do it. Elise, I think it's Alicia. Let me know if I got that wrong. You mentioned being diagnosed with BPD at 19, and with DBT, you were able to recover and no longer diagnosable at 24. I love that. Still struggle with mental health, and you resonate more with CPTSD. Like, that is such a huge success story. So I use DBT skills personally. So, the skills, my favorite skills are emotion regulation skills, distress tolerance skills, and mindfulness, because I am wired to not be in the moment. My mom was pregnant with me going through a divorce from my dad. Like, it didn't work out for them. I'm fine with him. Like, me and my dad get along fine, but like, it wasn't the right thing for them. And so imagine the stress of in the 80s going through a divorce. We ended up homeless. We ended up living in Japan. We had housing, everything was safe there, but she was still a single parent and managing all of these things. And so my wiring was just naturally very and really the work of Lynn Lyons, and I have an anxiety video, so, I might have to link it in the comments. Let me know if I should link it in the comments, but, the approach with anxiety that I use is that anxiety wants certainty and control, 2 things we don't have, and so me accepting that it's that radical acceptance. It's things are going to be uncertain. Things are going to be out of my control. My kid at some point is going to come up here and demand food. He just is. And the food is prepared in the fridge. All his dad would have to do is just like pop it in the microwave, but like it is what it is. And so I shared a resource of, do you have BPD or CPTSD? And this is where that image that I think I have this in the, yes, I know I have it in the thumbnail, where and I have this linked because this one is the reparentyoursoul.com, and I have the link down in the description. But with BPD, there's more impulsivity, fear of abandonment, inappropriate expressions of anger, extreme mood swings, very volatile relationships. Within CPTSD, that's where you can have nightmares, somatic distress, hypervigilance, sense of threat, avoidance, flashbacks, unwanted memories. And then where they overlap can be emotion dysregulation, self destructive behaviors, dissociation or paranoia, negative self image, and then feelings of emptiness and the sense of numbness. And now this is just something that somebody created. Okay. So this isn't based on, you know, so this is something that somebody created. Sometimes people might bicker back and forth about what falls in and what doesn't. I just thought this was a good description. Okay, we're on borrowed time. Let's talk about histrionic personality disorder. So, and I smile not because, so I these things are interesting to me, and hopefully we're all family here and I don't have to explain. So, an individual with histrionic personality disorder needs to be the center of attention. There can sometimes be seductive or provocative behavior, shifting and very shallow emotions. And so that's where I'm just going to say it because Dr. Curry said it first. So, Amber Heard on the stand very quickly shifting in and out of being very distressed to being fine at, like, the drop of a hat, where the emotion is shallow. So, it seemed strong, but, like, it wasn't deep because she was fine very, very quickly. And so that is a characteristic of histrionic personality disorder, uses appearance to draw attention, impressionistic and vague speech, dramatic or exaggerated emotions, suggestible and easily influenced by others, thinks relationships are closer than they are. All right. So with histrionic personality disorder, in my experience, there often is a history of child SA. Like, that's just in my experience, that's normally what's there. So what can influence this is genetics, childhood trauma, and parenting skills. And so children who experience parenting styles that lack boundaries, are overindulgent or inconsistent, may be more likely to develop histrionic personality disorder. All right. All of these things can be treated, but I just think it's interesting for us to talk about. Lastly, for antisocial personality disorder, so this is the one that we see with individuals like, I would say, just me personally, I would say Daryl Brooks, possibly even Wade Wade Wilson, is that his name? He was a recent guy down in Florida that was just convicted and sentenced to the death penalty. I will cover the death penalty phase if they have some streamed experts that I can cover, because the judge is going to make a final ruling on his sentence, I think later this month. I could be wrong. But with antisocial personality disorder, this is where they manipulate or deceive people, exploit or take advantage of others for their own benefit, and they do not feel bad about it, disregard the law or the rights of others, and feel no remorse for their actions. All right. There can often be this hostility towards others, impulsive behaviors, disregard for the rules, feeling of feeling of superiority that's different from narcissistic personality disorder. It's more of a I'm above the law, I'm above authority in that kind of way, versus with narcissistic personality disorder, it's just I think I'm better, but secretly I'm insecure and I know that I'm not and have a very fragile ego. Individuals with antisocial personality disorder, they often know exactly who they are, and that feeling of superiority, it doesn't come out of that insecure place like narcissistic personality disorder. All right? Often manipulating others and not accepting responsibility. All right? It can often start with conduct disorder, and then there can be some overlap with ADHD, depression, and oppositional defiant disorder. That's a disorder that I'm not a fan of, and y'all appropriately corrected me in the chat that you can get diagnosed with oppositional defiant disorder as an adult. It's just not something that I personally would do. My screen is freezing, and I think it knows that, like, I need to go and feed my kid. He's fine. I hear him and dad downstairs. Do y'all have any last minute questions? Yay, Nori. I'm so glad that my kids' interruptions make you smile. There is going to be a chapter in my new book about beyond the book kids, because there is no one book that helped me parent my child. I have like an abundance of books and resources because I have a mini me. And to parent him in a way that was different from how I was parented, because the way my mom controlled me was by using fear and intimidation. Like I knew she loved me, but there was fear and intimidation. And so I don't want to do that with my child. I want him to do what's right because he knows it's right. And when he makes a mistake, he has consequences. Like that's just how we do it. And just because a parent has a personality disorder does not mean that a child will have one. And with personality disorders, some people can be narcissistically defended. And what I mean by that, and that comes from the work of Dr. We're mutuals over on Instagram. He's gonna I hope he doesn't watch my YouTube. I forgot his name. Does he come right up? Oh my gosh. I saw him in person recently. Doctor. Oh my gosh. Y'all, I've said it before. I'll find it if y'all want it, but it's narcissistically defended. And what happens is during stress or during conflict, the person might display some narcissistic features, but it's not consistent. It's not in their personality. It doesn't happen at work. It doesn't happen in these other situations. It's just in those in like when they're stressed. That's when they start to interpret feedback as criticism, and it's only happening during those times. And I had never heard of that, and so I wanted to share that. The last nugget that I will leave you with is yellow rock. So y'all let me know in the chat if y'all have ever heard about yellow rock, because we've all heard about gray rock. For the first time, I heard about yellow rock. And thank you for the super chat. I was going to talk about BPD versus autism. So let me look that up. You just got to make sure the kid doesn't get hungry. As long as the kid doesn't get hungry, we're good. BPD versus autism. And I will link this here. So thoughts on CBT? I have been very vocal. I'm not a fan on traditional cognitive behavior therapy. I think that's why I like dialectical behavior therapy because it infuses validation. Because if a therapist were to tell me, you're being irrational, like I don't like that wouldn't be particularly helpful for me. But if they say, I get how you feel that way, let's dig a little deeper. And if they met me where I was first and then we did some of the challenging, that would be fine. But just telling me, "Don't think that way. Just do thought stopping." That's not particularly helpful for me. I do like the framework of cognitive behavior therapy because it has that with cognitive behavior therapy that our thoughts impact our behavior and our feelings. I'm a fan of the general framework, but not the like traditional, you know, irrational thought, challenge the thought, make a more balanced thought. The way I was trained in graduate school was to do a thought record where you sat down with somebody and it's I have never done a thought record in my private practice. I think a client asked for one and I probably did it with the person who asked for it. Excuse me. I don't like them. I don't uh to me CBT can be invalidating for the global majority, so people that are um that come from marginalized groups, and then also people that just have different experiences and people who have trauma. CBT can feel very invalidating. All right. So BPD versus autism. So the overlap can be sometimes there can be and with both, there can sometimes be relationship difficulty, increased risk of self-harm, um, a difficulty with impulse control, difficulty regulating intense emotions, rejection sensitivity, shame. So those are some of the kind of the things that can kind of be in both. With borderline personality disorder, there can be this black and white thinking, but it's not like the rigidity of autism. So with autism, there's this no, it has to be my way because like it's a cognitive rigidity. With BPD, it's more of like an infant, like a it's more of a tantrum almost, or like it's more of an emotional immaturity, and it can be very different. Uh um with autism, there can be these specialized interests that are part of a person's identity, and without those, the person might feel empty or aimless. With BPD, there's a persistent emptiness that nothing can fill. There's this chronic thoughts and feelings of worthlessness and lack of purpose. With BPD, there can be this intense volatile relationships. With with autism, it there can be a similar difficulty maintaining and establishing relationships, and both of them can be based on like a lack of skill, but one is viewed more as a developmental disorder or condition. The other is viewed as more of a this person never learned these skills. Like this is not something that they ever developed. It wasn't that they like because if sometimes if you teach somebody with BPD these skills, they're able they're able to develop those interpersonal skills. And then with autism, sometimes dialectical behavior therapy is sometimes used with individuals with autism because you're teaching a lot of the same emotion regulation skills. You're teaching a lot of those same things. With autism, there can be this masked identity. Often, individuals with autism will mask their kind of their true self to kind of fit in and form with what other people want. With borderline personality disorder, there's more of this pervasive pattern and instability of a sense of self. There is no true sense of self. It's not a mask. Like the sense of self doesn't really exist. And so, all right. So I linked that there. Uh, and then she goes into these a little bit more. I hope that that is helpful. All right. Once again, autism is not my specialty. I do work with individuals on the autism spectrum. When there is a history of trauma, I tend to kind of focus more that way and to repair that base. That's normally my focus. Now, sometimes individuals with autism have experienced like childhood trauma. And so that's where once they have that diagnosis, I partner with that person to figure out what's going to work best for them. And that was the comment that I smiled at earlier was somebody compared me to Carl Rogers. I thought that was sweet. Let me see if I can't I can't find that. So my approach with clients is what I call client centered, where I partner with clients to figure out what's going to work best for them. And for some clients, it's not me. Like and that's okay. I help them find somebody that's a better fit. And some clients wait for months. Right now, I'm not accepting new clients. I don't do these videos to build my outpatient caseload. I stay fully booked. I do this to help give education for those people that I could never work with, that I could never see. And this was the comment. You're a modern day Carl Rogers, giving your patients unconditional positive regard. Yes. And I take it to another step of because that unconditional positive regard, I wouldn't work with somebody that I couldn't hold that for. That's why I don't do forensics. So I like talking about these cases. I like talking about these things, but I do not do forensic work. I recently stopped doing court ordered evaluations because I have a 2 to 3 month wait list for regular psychological testing, people who are looking to get a diagnosis. And I make more money doing court ordered evaluations, but it doesn't give me joy. I'm gonna Marie Claire it. I don't know. Like it doesn't give me joy. I stopped doing them. I work for myself and I let the lawyers that refer to me know here are the local people that do them. I am no longer an option. And I don't do them. Often people are calling like 1 month before court trying to get in, and it's just and River Skull, welcome to the Psych Nerds. I appreciate the likes, the subs, the comments, the engagement, and I just appreciate this community so much. This is why I go live because it's just y'all are the best. Just gonna it didn't give me joy. I let go of the court ordered evaluations. I didn't want to do them anymore. And so I didn't. I have a wait list. Right? I don't because the court ordered ones, like they're like, I have court and I need and I feel for them. Does that make sense? I feel for it, but it's just not what I enjoy. I would rather assess somebody that is struggling at school and knows they have ADHD and they just need the confirmation to then get, treatment and support. And so that's that's what I do. I'm so glad that y'all were here. Thank y'all so much for watching. I'm gonna figure out what we're gonna do on Saturday. Saturday, we're gonna stream again, talking about some case. We're gonna talk about something. I'm gonna figure it out by Saturday. I hope you all enjoy the rest of your evening. Gonna go get the kiddos some food. Bye.